is Dr. Srinivas Samvedan, who is the organizing chairperson of Criticare 2026, and Dr. Kalavati, who is my counterpart and she is the co-organizing secretary at Criticare 2026. This year, the theme is humanization in the era of data science. It's a 3-day conference, will be attended by more than 3,000 delegates across the world. So there are delegates from other nations as well, more than 50 international faculties and more than 300 national faculties. We will be covering all topics that affect the patients who become critically ill and they get admitted to ICU, whether that is lung issue, heart issue, brain issue, kidney or liver. So this conference will discuss these important aspects from the leaders across the world in different specialities of critical care, and it will help us in understanding the issues, and it will also help the community when we are able to find solutions to these life-threatening conditions. Thank you.
Now, Dr. Kalavati, in the Criticare 2026 order, co-organizing secretary. ஸோ இந்த வருஷத்தில் ஒரு வாட்டி நடக்கிற இந்த கான்ஃபரன்ஸில் வந்து இந்த நாடு முழுவதில் வந்து அதுக்கப்புறம் பல்வேறு நாடுகளில் இருந்தும் கூட எக்ஸ்பர்ட்ஸ் வந்திருக்காங்க. அந்த மாதிரி எக்ஸ்பர்ட்ஸ் கூடுற ஒரு கான்ஃபரன்ஸ் தான் இது. உலகத்தில் நடக்கிற எல்லா டெக்னாலஜி அப்புறம் எல்லா டெவலப்மெண்ட்ஸு எல்லாத்தையும் இங்கே வந்து பரிமாற்றம் நடக்கும், கற்றுக்கொள்ளுதல் நடக்கும். அதுக்கப்புறம் இந்தியா ஃபுல்லாகவுமே இருக்கிற வேரியஸ் ப்ராக்டிஷனர்ஸு இங்கே வந்து கிரிட்டிக்கல் கேரில், அதாவது தீவிர சிகிச்சையில் என்னெல்லாம் டெவலப்மெண்ட்ஸ் இருக்குது, என்ன கைட்லைன்ஸ் இருக்குது, என்ன ரெக்கமெண்டேஷன்ஸ் இருக்குது, என்ன ப்ராக்டிசஸ் நம்ம ஃபாலோ பண்ணலாம், என்ன பிரச்சனைகள் இருக்குது, இது எல்லாத்தையுமே வந்து டிஸ்கஸ் பண்ணி நம்ம கற்றுக்கிறதுக்கான ஒரு நிகழ்ச்சியாக இருக்குது. ஸோ இதில் வந்து 3000க்கும் மேலான டெலிகேட்ஸ் பார்ட்டிசிபேட் பண்ணுறாங்க. எல்லாமே வந்து நம்மளுடைய அன்றாட ICU ப்ராக்டிஸ்க்கு ஹெல்ப்ஃபுல்லாக இருக்கும். அதே போல் கொஞ்சம் நேரத்துக்கு முன்னாடி நம்ம ஆன்டி மைக்ரோபியல் ரெசிஸ்டன்ஸ் பற்றி டிஸ்கஸ் பண்ணோம். அது ஒரு மிகப்பெரிய பிரச்சனையாக இருக்குது நம்மளுக்கு. அதை குறித்தும் இந்த கான்ஃபரன்ஸில் டிஸ்கஸ் பண்ணுறோம். அது மட்டும் இல்லை, பிரெயின் இன்ஜுரியாக இருந்தால் எப்படி மேனேஜ் பண்ணுறது, லங் இன்ஜுரியாக இருந்தால் எப்படி மேனேஜ் பண்ணுறது, ரோட் டிராஃபிக் ஆக்சிடென்ட்னால் எப்படி மேனேஜ் பண்ணுறது, மல்டி ஆர்கன் ஃபெயிலியர், செப்சிஸ்னால் எப்படி மேனேஜ் பண்ணுறது, இதில் என்ன டெவலப்மெண்ட்ஸ் இருக்குது, இது எல்லாமே கூட நம்ம இந்த கான்ஃபரன்ஸில் டிஸ்கஸ் பண்ணுறோம். ஸோ இட் இஸ் அ நாலேஜ் ஃபெஸ்ட். சுருக்கி சொன்னால் இது கற்றுக்கொள்ளுதலுக்கு ஒரு பெரிய நிகழ்ச்சி, ஒரு பெரிய சந்தர்ப்பம். நன்றி.
Lot of exhibitors have participated in the conference and they have shared their confidence in this scientific content. The main theme of this year's conference is humanization in the era of data science, which means we all know that nowadays artificial intelligence is everywhere and medical science is also not untouched. But how do we as doctors continue to maintain our empathy, our humane touch towards the patients with the help of getting more information, more analysis of artificial intelligence, and that is the theme of this year's conference. In these sessions, various sessions, you will hear about the burning issues in critical care like antibiotic resistance, what we call as antimicrobial resistance. So we will hear from the leading experts in this field how to combat this antibiotic resistance, how to fight these dreaded infections which happen where only very few options are left. We will also be looking at sessions which cover the various organ support systems like ventilation, dialysis support, liver support, heart support, ECMO support. So the conference will revolve all around this. I would request Dr. Srinivas, who is the president of this society and the current chairperson of Criticare 2026, to share more light on the scientific content.
On behalf of the Indian Society of Critical Care Medicine, we are extremely grateful to all of you for joining us this afternoon for this interaction. The society has always been in the forefront of looking after patient care and their interests and their rights as well. As Sachin has said, with the arrival of data science, a lot of people have the fear that we become impersonal in our interactions with our patients, which is what we are trying to dispel. because data science and artificial intelligence are only going to improve the way we tailor or fine-tune the therapy for each individualized patient, which is called in our terms as personalized care. So that is what data science is all about, and that's what we are trying to do. The scientific content will focus on a lot of such issues. A little bit about the society. It's a charitable society, not-for-profit society, which takes training and education as its motto. That's the driving fabric of the society. And we have also embarked upon a lot of corporate responsibilities, social responsibilities, rather not corporate, in the terms of training school children in how to do CPR, that is resuscitating these children and people who collapse on the road. So the last 1 year, the society has contributed about 100 training mannequins or models to our branches, about 105 of them, at a cost of about 10 lakhs. And we have trained about 90,000 students across the country in doing life-saving CPR. We have also extended this to airports. The first session was done at the Guwahati airport, and we're also taking it to gated communities where the elderly and the needy reside. Apart from that, the society has got our training programs for nurses, for pharmacists, for respiratory therapists and nutritionists, so that the care that is delivered to the patients is global and comprehensive. So please, if you have time, we are happy to have you visit all our sessions, listen to national and international speakers. We have about 50 international speakers who have come. Some of them have come on their own from as far as UK and the United States to share their experience and learn from us as well what intensive care is practiced in a different way in India. So welcome again.
Medicine is one of the major stakeholders as far as infection management and infection control is concerned in the entire country. And we as intensivists, we see the most worst kind of infections which can happen in the community. And all those patients, they come to intensive care unit for their management. Now, whatever we do in ICU, because that is just, I think, a tip of iceberg, what we are seeing and what we are doing. But the majority of the part which we are not seeing and which is prevailing in the community, that is the most dangerous one. So, as a critical care specialist, we feel that these should be taken care at community level itself, rather than taking all this care in the intensive care unit. So if we keep the preventive part a very strong one as far as development or developing these infections are concerned, and we try to control this at community level, obviously, and at small hospital level, because whenever we all work at tertiary level hospitals, but whenever we see a patient is coming from a small hospital, they already have carried those infections and now they come to our ICUs. And here we face the actual problem. So now what is needed? The awareness which we have at tertiary care level hospitals need to be percolated to the small sector or small hospitals, because they should also know that yes, this is a major concern and we have to handle this kind of infection at their own level. So if they understand, I think the burden will definitely reduce. So what they need to do is that prevention. So infection prevention protocols, which they need to implement in their hospitals in a very strong manner. And government is running many projects, and they have issued guidelines to control this infection burden. So that is one thing. Secondly, the inappropriate use of antibiotics. Before the patient comes to our tertiary level center, what happens? They are already done with the major antibiotics which we actually use in tertiary care center for highly resistant organisms. And these antibiotics are given at peripheral level. They just take these antibiotics as simple antibiotics and they give it to the patients. And the resultant is finally, because of inappropriate use of antibiotics, these people develop resistance. And finally, the cross infections which happens amongst the patient, and that is very, very important. And knowledge and education, that is one of the important things which I understand needs to be given to all the healthcare workers, that what are the strategies we should apply so that these infections can be prevented. Because what is happening in future, we have very limited pool of antibiotics. If we feel that everything can be done with antibiotics, that is not possible. So we have to follow certain strict infection prevention measures, and that is what I feel that is going to help in future. And secondly, another important thing is our diagnostic labs. We have to strengthen our diagnostic labs so that all those things which comes out of these small centers, it should be provided free of cost. The diagnostic cost is very high. So if they get free of cost these diagnostic facilities, then definitely we'll be able to diagnose the infection in a more fast manner, and we'll be able to treat and control also. That's all. Thank you.
All for this cricket year 2026 mega event in this city of South City of Chennai. So AMR the number thing very frequently high in the India. The reason behind is that the basic is lack of awareness. Lack of awareness not only in the public but as well as in the doctors also. So people are prescribing antibiotic or people are taking antibiotic even from the medical store. No restriction on this. So and other thing that Pradeep Rangappa already mentioned, the diagnostic challenge. Because delaying the diagnosis, delaying the culture sensitivity, all these get transmitted to MR. So we need to create awareness in the both levels, in the public and as well as in the community. Community, that means in the doctor's education and paramedical staff and infection control practitioners, especially in ICU. So that is all three things we can do together, we can achieve our goal. Without doing these all three things, it's very difficult and this is very challenging issue in the coming years.
By my previous senior speakers, that it is the practice that we have to change. Every fever in the ICU does not mean that it is infection. You have to actually work on it and decipher that this fever is because of infection, and then you look at what antibiotics you are prescribing. Does it actually make sense to give a particular antibiotic in a particular situation? Because that fear that everything is infection and what will happen to my patient if I don't give antibiotics is one of the main reasons that we overprescribe and generally wrongly prescribe these medications, which eventually give rise to resistance in these very, very smart bacteria. They are much smarter than what we think, and this creates the entire vicious cycle. They become resistant, you give something else, and this is where the antibiotic stewardship comes into the play. You have to be very diligent in choosing your antibiotics. You have to be very diligent in doing the assessment that why is this patient sick? What is the source of sepsis? If there is sepsis, give very rational antibiotics for a very defined period. It can't go on that once you write an antibiotic, it goes on for a number of days. So all these simple measures, but I would say daredevil measures, because that fear psychology has to go out. Yes, you can actually try to establish antibiotic stewardship, and these are small steps. If all of us establish antibiotic stewardship in our respective workplaces, then only this antibiotic resistance can be fought. One person doing it in one hospital and the rest not following is actually not going to help us, rather it would worsen the situation.
The antibiotic resistance, and the worst thing is that we face a roadblock when there are infections with certain organisms, and we have to take preventive and protective actions to avoid that for the population to be safe. So there are multiple steps to bring it to that level of safety, and it, as Dr. Ravi Tyagi said, it starts from avoiding unnecessary antibiotics to prescribing antibiotics responsibly and identifying infections rightly and giving the right antibiotic with the right dosing. And it is just not that, it also involves an awareness on infection control and infection prevention. Preventive actions also matter. And how the whole, in an organization also, the whole staff from top to at all levels, I would say, need to be aware on practicing in everyday hospital practices to avoid infections. So infection control is equally important in this area.
Just share your view on future direction in tackling AMR in India.
I think most of you would have heard about the rising incidence of antimicrobial resistance. And if you look at the global statistics, in the coming days, antimicrobial resistance and infections in the intensive care unit or in the hospitalized patients or for that matter in the community will be one of the major reasons why people are going to die. And the sad part is there are phenomenal advancements which are happening in the industry of healthcare. But when you look at the specific field of managing infections, the kind of innovations and developments that we want are not happening for multiple reasons. And that is the reason why in a country like India with 1.4 billion population, right, not having the regulations on how to prescribe antibiotics or how to deliver antibiotics, we are going to face a major challenge. And antibiotics are a very different kind of drugs. For example, if you don't use a specific drug in a specific population, only that particular individual will be affected. But antibiotics are a class of drugs which are going to affect the entire community. So anybody can be a collateral damage. You may not use an antibiotic, but if there is misuse of antibiotics in the community and if there is increased drug resistance in the community, then some of your near and dear ones may be affected despite they not being exposed to antibiotics in the past. So that is the challenge that we have to face, and unless we have trainings, repeated trainings, creating awareness, getting regulations, and from the industry side, innovating in technologies, for a population of 1.4 billion, we can imagine the number of people who are going to be affected in the coming days. So the idea of having this conference is to not only create awareness, but also understand and learn the science behind how to prescribe antibiotics. So writing an antibiotic is probably the simplest thing. That anybody just go to the medical hall, anybody gets a cold cough fever, you just pop up some antibiotic. That's not the way you should use antibiotics. So there is a science behind how you write an antibiotic, who should get, when should they get, why should they get, for how long should they get. So until unless each and every medical practitioner in the country starts practicing it meticulously, I think the coming days are going to be very risky for a large number of Indian population. So the whole idea, or one of the themes or one of the key core areas of this conference is to discuss this science, understand this science, share the knowledge, and not only train ourselves, but also train the next generation of doctors who are going to be the leaders of treating patients in the coming days. Thank you.
Science with us.
This house already has discussed with the senior speakers. I would like to add on very few things. That there is a two pathway of this. One to go to the community level to the people, and one to the physician, the treating physician, and among the treating physician, among all the subspecialty. So this all the motto of this conference is that we have to keep the awareness from the physician side as well as from the community level to make sure that the use of antibiotic is not like just a paracetamol or just a medication to just go to the pharmacy and just take it for any fever or any kind of things. Because nowadays what we see we are more focused on seeing all the medication prescribed by the Instagram or the Facebooks. and we'll try to get all these things that whoever is suggesting, they make some so-called influencer and then get it done. Actually, those people are getting, if you are not scientifically valid data, then we are going to reaching the era when we don't have any medication to treat it. I think you will be very careful about that. So, and this all conference on behalf of Indian Society of Critical Medicine, we would like to focus on the doctors, the future generation doctors, and even the doctors to get their knowledge updated such a way that they come into data not by what I know and you know, based on the scientific evidence, and that's with all the ethos of the Indian Society of Critical Medicine. And we also understand that it is not only done in one-sided, we also have to, as Dr. Srinivasan mentioned that certain points, that we also have to go to the public and make them awareness that it is not that, because in India it's very simple, you can go to the shop, you can get the medicine, you can take it the medicine, even the pharmacist who is staying there, they can prescribe the medications. So it's our responsibility to make them aware of that you have to take a medication, you should know that why you are taking the medications. It's not as simple as it is. And if you can get into two way, we can almost done the damage control. Because this is not the issue of today. This is what the world we are going to provide for the next generations. And if we are not able to provide a good world for the next generation, not only we will suffer, all future generation will suffer, and we will be held responsible for that. So it's our moral responsibility for make these things happen. And that's the pathway Indian Society of Critical Medicine has taken to get the done in the both way, not only the community but also the doctors make the education. On that notes, I think that will be the message should be very loud and clear that if you want to get a medication, it should be based on the scientific evidence, not based on any voodoo medicine.
To antimicrobial resistance, it's a collective responsibility of the medical fraternity as a whole. It's not only confined to intensivists or any other group, it's a collective responsibility of the intensivists, of the entire medical community as a whole. And one more thing is, as we have strict guidelines for everything else, antibiotics should also have guidelines, and it should become a governmental responsibility as well to ensure that everybody prescribes the right way. So that's the way forward, I think.
AMR is one of the critical public challenges taking place in the future. So, one of the main problem is that it's like the primary level. You are saying that all the people are from the tertiary level. So this one of the common person get infected by a virus, he directly go to the primary hospitals. So one of the problem is that these doctors in the primary hospitals, they prescribe these antibiotics. So that is one of the problems. That is how do you tackle these issues more? Because this bodies like you, doctors or bodies like you, do you have framework to tackle these kind of issues in the primary level?
Actually, I tell you, suppose you develop an URI today, what will you do? You will go, either you will go directly to a medicine shop and they will ask the person, give me some medicine, I am having a little bit cough and cold and this little bit of fever. And he is the first man to give you some medication. This is a big problem.
That's also a problem. Okay, I agree with that. But the main problem is the local level doctors.
Yeah, I'm coming to that. Okay, now the second thing, this is the first thing. First muscle reflex or first your brain reflex takes you to a medicine shop and you buy some medicine. The second reflex is that you see that which is the nearest hospital to your residence. Okay, that is the second reflex. And you go to the nearest hospital and you don't know the level of a specialist or level of doctors who are working there. You just see, for a layman, a doctor is a doctor, whether he is a MBBS doctor or whether he is a super specialist doctor. You have a feeling that he is a doctor and he will give me the right thing when I go and say my complaints, and he will take it in a positive way and he will give me the doctor also does the right thing. Problem, he also feels that if a patient has come, I have to treat him in a best manner. No doctors tries to give wrong medicine or wrong treatment to any patient. That is, you have to keep in mind that doctors' thought processes are always positive. They always try to help and try to do their best. But the problem is that there are two problems. One is that these doctors who are working in the periphery, they are never evaluated for their knowledge level after they pass out from their primary medical degree or once they come out with their primary medical degree. And this kind of conferences are needed to be attained by those doctors who are working in periphery to understand what is happening in the world and what exactly is happening in the community. Because they have not upgraded their knowledge, so they will prescribe you the wrong thing. Because they are not updated with the current happenings and because they are not aware, so there are two important things. One is lack of awareness and lack of knowledge. So what is the solution for that? And who will take care of that solution, problem? You are getting my point? So we need to make in our country as such, as a whole, we need to make some system which should continue on annual basis or biannual basis every 2 years, that some kind of evaluation for all those who have passed this medical degree or who have taken medical degree, whether they have upgraded their knowledge to their practice or not. Whatever practice they are doing, they have to upgrade their knowledge. Whether they have attended some CAP, whether they have attended some workshop, they have attended some course, those things are very, very important. If they cannot attend on their own, from their own pocket because everything costs money, it is the responsibility of the community or it is the responsibility of the stakeholders to organize something for increasing their awareness as well as knowledge.
One more thing I should just point out, one thing is that it's conflict of interest. Because many doctors, they are qualified doctors, everything is there, the qualification, everything is there, but the problem is that they are in the conflict of interest because many pharmaceutical companies, they tie up with the pharmaceutical companies and then they prescribe their medicines. That is happening. So how do you going to tackle these kind of main challenges? The people, leaders like you go to the tertiary level, how to percolate this kind of information and strict guidelines into this primary level.
That is why we are doing these conferences. Now we want people to come and attend. This conference is for those purposes only, that we want all people from all over Chennai, not only, it is a national conference, we want people from all over the country to come and attend and see. We are full of knowledge, we are ready to percolate, we are ready to give it to you, we are ready to increase your awareness, we are ready to increase your knowledge, everything is there. But those who are actually needed to take this knowledge, take this awareness, their mindset is different. You are getting my point? So there is a huge gap between the givers and takers.
I am from Chennai Press News. We are talking about AMR. Is only because of through antibiotics misuse or other unhealed illness in the ICUs? What about that? Situations are different.
See, whenever there is a problem, we should understand there are multiple reasons why a problem happens. So it's very simple to say that antimicrobial resistance is happening because the doctors are prescribing antibiotics. That's not the only reason. There are multiple reasons. For example, let us just quote the example that my prestigious, my dear friend has cited. A simple cold and cough comes to you. We know that major times because of a viral infection, and no matter what you do, it stays for a couple of days. But there is a tendency among ourselves to heal it faster. And there is a common tendency, for pressurizing from the general public also for the doctors to prescribe antibiotics. public love to go to those doctors where they get an antibiotic. There is use of antibiotics not only in humans, but extensive use of antibiotics in the poultry industry, in the dairy industry, with absolutely no regulations. There is nobody who can. So, as I said, antibiotics are one class of drugs which, if you use in the community, it's going to affect the entire community. Okay, so whenever there are resistant genes that develop, they don't stay in that particular individual alone. They spread. So somebody from the community may get an infection from resistant genes. So even if you have not used, but if there is rampant misuse from multiple angles in the community, there is a high probability that somebody might get an infection with a resistant organism, and when that particular person goes to the hospital, the first line antibiotics will not work. So it's never one area or one reason. It's the entire system. It's everybody's responsibility. Everybody in some way is contributing to the development of antimicrobial resistance, and that is the reason why the solution also has to come from everybody.
Second question. Now we are talking about AE everywhere. How you people are well equipped to handle AE actually? So I mean, fully trained or something.
So training wise, yes. See, the one thing we have to remember is that AI is still in developmental phase in bringing it into bedside practice. We are not fully integrated into bedside practice. We are all learning on how to implement AI. Small aspects of patient care, we are using AI for small things, but comprehensively we are still not reached. As far as how we are equipping ourselves, in this particular conference, we had a session, we had a training program called DataCon, and where we actually, as doctors, sat with data scientists from the Indian Institute of Technology, Chennai, and those young, dynamic data scientists actually taught us how to analyze data, how to make sense of the lot of information that comes from the data, and how to come to conclusion based on the data. That is called DataCon. Not only that, the Indian Society of Critical Care Medicine is running a 3-month certification program on using artificial intelligence in critical care for our members. With the first batch has just completed its training and will be due for appearing for their exams soon after this meeting is over. But it's going to be a challenge because the number of people who are trained at this point in this country is very less. But the speed with which AI is entering into healthcare is tremendous. Unless we gear up and catch up with it, we will be left behind.
So my first question, the AMR, only because of antibiotics or the surrounding areas?
No, so what you are saying, the term AMR is antimicrobial resistance. Okay, so the organ, see, you have to understand one thing, nature is beautiful. Every organism which nature has created fights to survive. Fights to survive. Darwin's theory of evolution said survival of the fittest and struggle for survival. Just like we struggle for survival, the bacteria, the virus, the fungus also will struggle for survival. So when I use antibiotics inappropriately, I am giving substrate for the organism to mount its survival response. For me, it is antimicrobial resistance. For the organism, it is survival. Right? It is nature. So we have to be disciplined and we have to regulate ourselves in not saying that this is a problem and how I'm speaking, giving lectures is not enough. How we implement it in practice is what matters.